Hi, I'm Dr. Maria Solindro, specializing in integrative anti-aging medicine, practicing in Pasadena, California. Welcome today for my sharing with you something about difficult to explain in a like a full way, but I would like to try to share with you some of my personal story or my patient story, and hopefully this will help you understanding what is called dementia or or what is called Alzheimer's. It's different. So basically, I would like to share with you about my father's story first. My father passed away last year. He was 92, passed away one day after his birthday. We were all there with him, all the children, grandchildren. But 2 years before he passed away, he lost the area of the brain that did not get the blood circulation from a very tiny stroke. But this area is where he stored all his memories. It is next to the hippocampus. He was a very healthy person, did not take any drugs or medications for anything. He recovered long time ago from his type 2 diabetes, and he enjoyed his life until he passed away. But 2 years before he passed, he lost all his memory. In this case, he never had any episodes of typical dementia that slowly progressed like the Alzheimer's disease. He will be staring at you, and after 2 to 3 hours, he will then say your name, and then he couldn't remember again. It is a very sad situation, as he was already 92. And it happened to be in the area or country where the off-label treatments were difficult to do, and it's not easy. So even he forgot how to eat, how to walk, and it's probably progressive if you do the scanning or MRI, but we didn't do that. And this all happened after his stroke, which is a reduction of the vascular bed in the brain area. Okay, we call it a vascular dementia because he lost his memory, or it is called memory impairment, but he did not have Alzheimer's. Today, I would like to share with you with the topic of dementia or other memory impairments. So memory impairments or dementia is a condition when mental ability is declined, and it can interfere with daily life activities, and it is not a disease. There is a specific disease called Alzheimer's, the most common cause of dementia. Dementia is not a normal symptom of aging. Many people reach 80, 90 years old and still have a good memories. That's true. But we can talk about the disease that it is the most concern among people. 50 million in the world is Alzheimer's disease. Alzheimer's hits 50 million people in the world. More than 7 million is in the United States. Over 80 years old, people who reach 80 years old and over, usually 30% will get dementia or, memory disorder. This can cause economic disaster because dementia or Alzheimer's might need care and they cannot take care of themselves. There are damages to the brain cells that affects the ability to communicate, thinking, behavior, and feeling. They cannot express their feeling. Now, maybe let's talk about early symptoms of Alzheimer's. Then we can understand the scope. It's very deep. Okay. Memory loss that disrupt daily life. Some of them, when they reach the moderate to severe Alzheimer's, they cannot even remember their family members. Challenges in planning or solving problems, they may not be able to do it again. And this can happen like a shock. You wouldn't think that is going to happen like yesterday, and it does. Difficulties in completing familiar tasks. For example, they cannot tie their shoes anymore, or they do not remember what is brushing teeth for, or how to do it. And they get confused with time and place. They think they are in somewhere else, and they do not know when, like the month, the date, the year. And they have trouble understanding visual images. You give them some images, and you ask them to draw, let's say, to follow whether it's square or it's overlapping squares. They do not do that, but they have lost also spatial relationship. New problems with words in speaking or writing. Their signature deteriorates. Okay, misplacing things and losing the ability to retrace step. I'm not talking about you forget where your key or your glasses when you put it on already. I'm not talking about that. It's something that you wouldn't imagine that they can actually misplace it or lost it, or ability to find a way to my office, let's say. I have a story to tell you later. Decrease or have poor judgment. They also often withdraw from work or social activities. And they have changes in mood and personality, often very sensitive. They get angry, short temper, and it's just like a different person when it gets very severe. Now, how to diagnose Alzheimer's, or whether we know that this is not Alzheimer's? Well, if you go to see a neurologist, because this is mainly their specialty, they will do a mental status test. They ask questions, and then they give you a score. Let's say 30 questions, and if you can only do 5 out of 30, you failed. But if you do 29 out of 30, they said you don't have Alzheimer's. They do physical exam, neurological exams, and the diagnostic tests and brain imaging will determine if you have Alzheimer's or not. It is important to understand that you can also test their genomics or the gene of the Alzheimer's. But it is very important to diagnose early and how to get support after the diagnosis, because there is a chance to slow down this disease or progress, and there is a chance to improve these symptoms. What about talking about onset of the disease? Well, normally after age 65, people get dementia, but it is not part of the aging process, right? Dementia is dementia, like memory impairment. But after age 65, the risk of having Alzheimer's double every 5 years. And after age 85, the risk reaches nearly 3 times. While most changes in the brain that cause dementia are permanent and worsen over time, but thinking and memory problem caused by following conditions can be improved when the condition is treated or addressed. Those are lack of vitamins or lack of nutrition, hormone imbalance, and other mineral deficiencies, or side effect of multiple drugs, treatments, or medications. Many medication has a side effects of brain impairment. Just be careful. Excess of using alcohol, let's say, or smoking. The smoking, it's because of the cadmium, or cadmium is the heavy metals that's found in tobacco. Thyroid hormone can cause impaired memory. So don't be scared that you have Alzheimer's if you have not checked all of these. And last is depression. People who are depressed and they have a lot of stress, they can have memory impairment. What about the strong risk factor in the family history? Yes, those who have parent, brother, or sister with Alzheimer's are most likely to develop the disease. The risk increases if more than one in the family member has the illness. When the disease tends to run in the family, either hereditary or environment factor or both may play a role. They both can actually play a role together. Some scientists now think that less vascularization to the brain can lead to what we call amyloid plaque, and which later on in Alzheimer's disease patients form a tau, TAU, which is a tangling of the amyloid plaque or the protein in the brain. I prepared several pictures, but my lack of preparing the conversion from the Zoom to the YouTube, now I don't have pictures. So let me just try to explain, okay? Amyloid plaque is like found and seen when you have the brain scan. Apparently can happen in normal person due to overstressed and can also cause dementia, as I have mentioned it, or hormone imbalance may cause amyloid plaque, and also poor nutrition. It is found in people after age 35, unfortunately. And can you imagine if you have amyloid plaque at the age of 35 and you do not know? So 15 years later, according to the research, when you hit age 50, this may cause the tau, the tangling of the amyloid plaque. It is best to diagnose early. When you have the amyloid plaque, then we can figure out what caused that and then prevent the tau, which leads you to Alzheimer's. So this is clear that you don't have to have Alzheimer's disease gene, and you can have Alzheimer's. When it is inherited or hereditary, 1906, Dr. Alois Alzheimer's discovered this disease. That's why it's called Alzheimer's, because of the name of the doctor. He autopsied the brain of a woman who died of unusual loss of memory. So he found the amyloid plaques and also the tau tangle. That's 1906. 1987, they found Alzheimer's gene. It's called PS1 or presenilin. PS1. P like Paul, presenilin. This is a mutation gene that increase the risk of people to have Alzheimer's. In 1992, which is 5 years later, they found the second mutation gene of inherited Alzheimer's. But only 1% of Alzheimer's cases caused by this deterministic gene, but only increase the risk of developing the disease. By 1995, 3 years later after the second mutation of the gene, they already found 4 genes defect that leads to Alzheimer's. But remember, it's only 1% increase the risk. So how about other problems? Yes, because it's the reduction of the vascularization in the brain. So head injuries, cardiac problems can be the cause of dementia. So Alzheimer's disease leads to nerve cells death and tissues lost throughout the brain. Over time, the brain will shrink dramatically, affecting nearly all its function. Very sad. And, you can go to Alzheimer's Association or alzheimers.org, and you can see all these description of the amyloid deposit with the tau tangling, okay? And then you can also see that when there is nutrients can supply the brain that does not have the amyloid plaque, and then the brain cannot, no longer can move through the cells. I mean, the oxygen cannot move through the cells, which eventually die. The most damaging form of the beta amyloid, they block the cells to signaling to synapses, okay? They activate immune systems. So they activate immune system cells and triggers inflammation. And then it will disable the cells. But in a healthy area of the brain, usually cells are parallel and nutrients can be delivered. In the area where tangles are forming, nutrients and other essential supplies can no longer move through the cells, which eventually die. So in advanced Alzheimer's disease, most of the cortex is seriously damaged. The cortex is the area of the brain. The brain shrink, so the size is smaller than normal brain due to widespread cell death. So individuals lost their ability to communicate, to recognize family and their loved one, and to care even for themselves, right? There's a questions here. Let's answer some of the questions. I think Liz asked these questions. Can they recognize when people come and visit them? Yes. Even my father with such a severe memory loss, he can recognize. He will look at us and maybe, okay, we don't know how to prove it, but maybe he'll think, I know this person, but who is she? And he will, you can see in his face, that he thinks, try to remember. And one day I decided to work next to him for 3 hours. Suddenly, he called my name. I was shocked because I wouldn't expect that, but he did. And then I looked at him and I talked to him. Okay, it's very important actually when people have dementia. They exercise and talk a lot about this, whatever, and whatever they like actually. And another question is, can we suppress the genetic or hereditary factors? Yes, I think this is what we call epigenomes or epigenetic factors that cause the dementia. And usually, when you are diagnosed with Alzheimer's, it's already like 20 years past this amyloid plaque and things like that. Nowadays, you heard people have Alzheimer's when they are 50 years old, 40, even 30. It's amazing. I never heard unheard before of that young age. Another questions. How to prevent memory problems and dementia? Okay, so this is not how to prevent Alzheimer's, how to prevent memory problems and dementia. So prevention of dementia, I suggest that adopting multiple healthy lifestyles or choices, including healthy diet, not smoking, regular exercise to improve the circulation, cognitive stimulations, like if you like to do puzzles or play chess or mahjong or whatever that stimulates your brain to think, okay, may decrease the risk of cognitive decline and dementia. Let me continue. Well, there is no proof or proven cure of treatment for Alzheimer's. Large research now strongly suggests that combining healthy habit promotes good brain health, you see, and it reduces the risk of the memory impairment. And this is said by Dr. Maria Carrillo. She's a PhD and she's the chief scientist of officers in Alzheimer's Association. Alcohol use disorder, it's abbreviated as AUD, and compulsive drinkers and smokers has proven to affect and increase the risk of dementia. And this research is done at UCSF, University of California of San Francisco, by Dr. Jaffe. And this is done on female veteran studies. This is affecting the function of recognition or cognitive function when you have all of the above, which is the alcohol use, compulsive drinkers, and smokers. I have another questions here. Is there conventional medication? Yes. So I'm doing the integrative medicine, but the conventional medicine was when I was trained, right, as a medical doctor. The FDA or US FDA has approved two types of medications. One is cholinesterase inhibitor. It inhibits the cholinesterase enzyme, and those are called Aricept, Exelon, Razadine. So these three medications are being used very often by neurologists when they think that the patient can be helped by taking these Aricept, Exelon, Razadine. None of these medication had proven cure of Alzheimer's, but it helps. And the memantine or Namenda is to treat the cognitive part, which is the recognition part. Yeah, so some patients are confused and they have problem thinking and reasoning. Now the memantine help or the Namenda. While current medication cannot stop the damage of the Alzheimer's that cause the brain cells death, they may help lessen or stabilize the symptoms for a limited time. by this affecting the certain chemicals like choline esterase. Yeah, uh, it inhibits that, stopping that. And doctors sometimes prescribe both types of medication together. I'll share another story of a combination treatment here. I have a patient. She's 93 years young. I said young because, if not because of the memory problem and the spinal cord injury that she had suffered last year. She was a very strong businesswoman, very smart, very sharp, and very intelligent. She had no significant medical problems, as far as I know. I took care of him. I took care of her almost 20 years, and always have a great, remarkable brain function. Somehow, she had a cerebrovascular accident, stroke, I think 4 years ago. Soon after that, she was diagnosed with Alzheimer's. Now, I haven't had a chance to take care of her at that time for 2.5 years. That's when she suffered from the stroke. And she was put, obviously, okay, conventionally, she was put on several drugs or medications. But her diagnosis of Alzheimer's made me very challenges, right? Because the family came back to me to improve her functional motoric function that she had 15 months ago when she ruptured the vessel or her vein in the neck area, which overnight accumulated a small bleeding of blood clump that pushes her spinal cord area of the cervical four until the thoracic one. That's pretty high, okay, but not high enough to affect her breathing, right? So it affects her extremities, upper and lower. So almost she had hemiplegia or paralyzed. So she went and undergone rehab. And this spinal cord injury, if it's partial, usually it can comes back if you treat them correctly. So fortunately, she was supported by her family members. She was supported in all kind of aspects, mentally, emotionally, okay? And when she came back to me about like 7 or 8 months ago, I review again her micronutrients, macronutrients, medications, and among all my patients, she had the best or great success using both conventional and also off-label neuron exosome, which is extract of the stem cell. She has a moderate improvement in both motoric, including her memory or dementia. I'm following her closely, and hopefully one day when we touch about this again, I can tell you how great she is. The family is very happy. I'm very happy. Patient is walking with a rollator or walker. Yesterday, I got the video, and she celebrated her birthday. She sings during therapy. She plays ball. So it's very touching. And she happened to be my father's friend. So how about diet and nutrition? Very important. Okay, so we will touch this now. So in my personal approach, okay, in my office here, I do integrative. So I work with neurologists who usually follow up the Alzheimer's situations. They they are the one who underwent the battery testing and also CT scan or MRI scan of the brain. So we have to work together. Most of my patients are undergoing heavy heavy metal detox. So I tested their urine 24 hours and provoked the heavy metals and look at the level. The last story I shared with you, she happened to have severe heavy metal detox. And I looked through the chart and I saw that. So we have been doing the detoxing. We can do IV detox and we can do oral detox now with the new technology, many supplementation that is food based. We can use that to detox. And so I would encourage people to start detoxing because we live in the environment that is very toxic. The air is toxic, the food is toxic, the water is toxic, right? And what about this? It's very toxic. I don't know if this affects our memory. I think so. This is radiation. So we have to be very careful and very smart now to stay healthy. And can we? Yes, we can. But don't just depend on last minute meanings that you want to wait until you lost your memory. It's very difficult. You lost your memory, you cannot remember. So it's not good, right? Okay, next one. Some of the patient, I urge them to do genomic testing. Genomic testing is a gene testing, but it comes with epigenetic. It's called epigenomes. So what is epigenetics? Epigenetics is other than gene, than the gene mutation. So if you get the gene mutations and then the epigenetic, then we call epigenomes. And that is usually an not encouragement, a list of protocol that are given to us that can hopefully suppress your genetic problems. So the gene mutation will not express. So this test is available. It has been available for 7 years. And the test will tell you also what kind of exercise you should do, diet, nutrition, environmental, and you have to focus on that because that is you. So phenotype is us, okay? Genotype is the gene, epigenome, and phenotype. So gene plus epigenetic will give you phenotype. So try to explain a little bit, right? So next one, I usually map the symptoms because everyone might look similar, but it's not the same, right? They are forgetful, but underlying other symptoms is different. And we minimize them with food-based supplements and brain support. Other than that, we have to make their hormone optimal, balanced mineral, amino acids, essential fatty acid. This one is the most talk about brain support. Essential fatty acid, which is a combination of EPA and DHA. The EPA is for the cardiovascular, the DHA is for the brain. So every patient has a different needs of micronutrients and macro, which is the food. And there are many off-label use of treatments that people or doctors are trying now, because otherwise you are facing 10 to 20 years of no quality of life. Now, we also have to be sensitive to their social aspect. Some like, can they still exercise? Can they still go out and meet their friends? And, this for the mild dementia, yes, they can. The moderate, maybe. Okay, so don't seclude them from all these publics or potential for them to enjoy life. So all this exercise has to be trusted to their family members, or if they cannot take care of themselves, then we have to call the social workers who usually work with us and place them in a board and or nursing home. Let's talk about macronutrients diets. Okay, it's very important, right? Your diet. You sleep for 8 hours, that's good. So you don't eat, that's good. Because some people, they just keep eating and it's not good. If you eat carbohydrate, especially, then it is not too good for the health of the brain. Intermittent fasting is encouraged now. Many of my patients do not understand what's intermittent fasting, but once you explain, they said, "Oh, I used to do that. I used to not eat in the morning. I used to not eat breakfast when I wake up late when I was young. Then I just have my meal and I have 2 meals instead of 3." But then in the early 60s to 70s, people said, "Oh, you have to eat 3 times a day minimum," and that's all past, right? Now you really have to eat healthy diet. So, for example, I already mentioned about omega-3, DHA, EPA for the heart, and DHA is for the brain. You can also take, for example, a handful of walnut. According to New York State study on mice, they did on mice, this walnut will improve memory and motor development, and which lowering also the risk of Alzheimer's. What diet is the best? Is Mediterranean diet. It's very suitable for the brain. It has plenty of amino acid and essential fatty acid. What about fish? Yes, fish, mackerel has the most omega. 1 cup of mackerel fish has over 6,000 milligram of omega 3, which is plenty. A lot of DHA. And how about salmon? Yes, it contains B12 and omega-3 to prevent slowing down of the brain function. How about eggs? Great. Now, eggs has to be organic. Organic eggs from the free cage chicken running around, right? That is what you want. You can eat more than 2 or 3, even 5 eggs if you want for the protein also. Other micronutrients is vitamin D, vitamin E, amino acid, and protein. So my favorite and easiest omega-3 is from chia seeds. When I was young, we used to have dessert, a drink dessert that has chia seeds in there. So now I just do like 1 tablespoonful, or and then I dip it in water. It will blown up a little bit and it looks like a small ice there. And then I love it. It doesn't taste anything, but having that also helps the bowel movement. Now let me see if there is other questions here. Okay. All right. Okay. All right. Okay. Agnes, Dr. Maria, I want to ask. Oh, okay. She said she forget names, and then see, is this Alzheimer's or dementia? I think I have already explained. It's not. It's just memory impairment. But I think we need to review your micronutrients, condition of your hormone, and everything else, just to improve that. So if we improve the condition of your nutrition, and you can feel it after 3 to 4 or 5 months, you feel like you're sharp again. So especially when you are only like age 50, 60, you shouldn't be forgetting too much, right? But like I said, you listen again. Amyloid plaque is there after age 35. They also found it. Maybe those people are people with a lot of stress. Thank you for the question. Great questions. Okay, so Victor, there is heavy advertising on supplement called Prevagen on TV and use of phosphatidylserine as a preventive. Your thoughts? Okay, I like that. Dr. Small has a book, Mem- Memory, Brain Memory, or something like that. And he described what an excellent phosphatidylserine is as an amino acid for our brain. And I always use phosphatidylserine to improve my patient's brain function. You take maybe 100 milligram twice a day, so 200 milligrams a day. Or if you think you have a moderate to severe problems, just increase it. Okay, a little bit generous, like 400 milligrams. And then don't be discouraged to take it like a month. You have to continue taking it maybe 3 to 4 months. You have to understand the vascularization is needed to bring that supplements, nutrients to your brain. So if you have too much amyloid plaque, then you have to improve with things like, that improve the vascularization. So, after evaluation of the blood test, what caused the lessening or reduction of the vascularization to the brain. Some people have carotid plaque, some people have vascular plaque already, so we need to reduce that. And we do have supplement reducing that. Okay, so Victor, that's a very good question. And the Prevagen, yes, you can try that. But again, if you have Alzheimer's, none of the conventional medication or supplements found to uh, cure the Alzheimer's, but it is improving the symptoms, and we need that, right? Okay. When the tau tangling is happening, they said that it's not going to, no, nothing can stop it. But I take something to prevent further, even if it doesn't stop it. So it would be interesting to follow up with that woman, 93 years old lady that was very smart. So if her memory comes back, then hopefully the off-label medication improve the vascularization and cut down all the tangling, hopefully. So Vicky, okay, thank you, Vicky. Yes, I like this one. Okay, very good. So the next question is, what is the genetic testing? I think I already answered that. How much does it cost? Yes, this genetic testing varies, but I use NAG, New Amsterdam Genomic. I use them because it has the epigenetic. You can test the gene, but many of these tests does not give us the epigenetic solution. Are those medication, next question, are those medication only medication available for Alzheimer's? Unfortunately, yes. And the last question, what about treatment for dementia? Treatment for dementia is the healthy solution, healthy aging solution that I have shared with you. You have to kind of reviewing your toxicity, your diet, which is macronutrients, your micro, that was macro, now it's micro, which is the nutrition available for your brain to be functioning well. Okay, and then hormonal imbalance is a big things there. And then also the last one is the stress or depression. So when you have all of these handled and reviewed, at least you have a program. And it's very sad if you can live healthy but you cannot remember anything, which is very bad. And some people said this diagnosis is very devastating. So well, hopefully this help you all. And if you like, please share my channel with other people or friends or relative and give thumbs up. For the comment, you can still do it when it's become a video. And hopefully I see you next week in my next YouTube. Thank you so much. This is Dr. Maria Solindro, Integrative Anti-Aging Medicine in Pasadena, California.